So about 3 years ago, I was working as a nurse at Providence Portland Hospital when an old friend reached out to me and asked if I could take a 15-minute call. I found someone to cover me on my shift, and I snuck off to the break room and gave him a call. My friend, Joe Novello, who's a nurse as well, pitched me on an idea he'd been thinking about for some time. He wanted to create efficiencies within healthcare by leveraging their nurses with modern technology. Considering I was in the middle of a hectic shift myself with call alarms and bed lights, bed alarms and call lights going off, I wanted to be a part of the change. I'd like to share with you a little bit about our company and the 3-year journey we've been on to date and how we're trying to enact change in healthcare, and also why I believe startups are a perfect match for healthcare organizations looking to make that change. There's 3 points that I want to make. First, that the agility, innovation, and passion found in the startup world can help ignite that change inside, or the agility, innovation, and passion found in the startup world can help ignite that change in the healthcare world. 2, that true change should come from the ground up, which is where many startups have to begin anyway. And 3, that in order to sustain that change, you need to promote a healthy work-life balance, which is something that you can do only if you practice what you preach. So after that brief phone call, we've been on a mission to provide nurses and those on the front lines of healthcare with modern technology. But before we could build a product, we had to reach out to thousands of nurses and nurse managers and hear from them, because who better to solve the demands of the healthcare world than the ones who are dealing with it face-by-face, face-to-face, shift-by-shift. So after we gathered all that feedback, we named our company NurseGrid. We launched our first product, NurseGrid Mobile, and we continued to get a bunch of feedback. We took all this feedback, we read it all, we iterated, we released new products, the new app back into the market, and did this over and over again, and are still doing it today. This is what all successful startups have to do, and it's something that is hard for larger organizations to do. The results have been astounding. To date, we now have the #1 nurse app in the nation, with nearly 500,000 nurses on our platform, and we've succeeded at doing what so many healthcare organizations struggle to do every day, which is getting their nurses to adopt and use new technology on their departments. And we did it by focusing on the end users first, and not necessarily on the executives in the C-suite with our initial product. So sustaining change is also difficult for startups and healthcare facilities alike. We believe that promoting a healthy work-life balance is a key element to doing that. But you can only do it if you practice what you preach. Our product tries to create those efficiencies within healthcare, but also decrease the noise that nurses receive when they're at home and not at work, and also help them receive a schedule that works for their personal life. Unfortunately, I didn't always follow my own advice. Early in the NurseGrid days, I was working full-time at the hospital and full-time at the NurseGrid office. This is Joe and I in our first office, running on little sleep and lots of caffeine. This wasn't healthy. At one point, my wife had to gently remind me that I still, in fact, had a wife. Obviously unhealthy for myself, unhealthy for our marriage, and unhealthy for the company, too. And staff nurses really are no different. When we're constantly overworked and burnt out and fatigued and bothered at home, our quality as healthcare givers declines. As I found that work-life balance myself, as we've added employees to our company, we even managed to add a son at home, but that's just an excuse to post a photo of my son. So our second product we released was our enterprise product, NurseGrid Manager. We're now in the process of rolling out to nearly 2,500 facilities. And the results of focusing on those end users has been that staff satisfaction on these departments has gone through the roof. And not only that, but we're decreasing the non-productivity time that these departments have, allowing the nurses to focus on providing quality patient care and not necessarily on how to use cumbersome technology. Of course, we couldn't do it without the support of our amazing team. Some of them are here today. We're now 35 people large. We have a bunch of investors who are also in the healthcare field in the Portland area, and then the thousands of nurses and nurse managers who've helped usher our technology into healthcare facilities across the nation. As a startup, we are freed from the bureaucracies of larger organizations like that found in many healthcare facilities. NurseGrid, and like the other companies we've heard from today, are able to build and iterate in a nimble way to meet the demands of the market that the market cannot do themselves. Passionate entrepreneurs should feel compelled to build companies for the healthcare world, and the healthcare world should welcome and embrace these passionate entrepreneurs with open arms. The more of these relationships that we see, the more likely that we are to enact true, meaningful, sustained change for years to come. Thank you.